tardes. Hoy tenemos invitado al doctor Roberto Pineda, que él es conocido por muchos de nosotros, especialista en córnea, trabaja en Boston, Estados Unidos, y es profesor asociado de la Universidad de Harvard. Como un amigo, le damos la bienvenida. So welcome, Roberto.
Es un placer.
So, we were interested in knowing how things are doing there in Boston around COVID.
Yes. So Juan Pablo, the past few weeks have been very interesting for our hospitals. A few weeks ago, the governor basically shut down many businesses, any non-essential businesses, and we were asked to, defer or remove any non-urgent or emergent patients from our schedules, both in the clinics and in the operating room. In addition, there's been a lot of protocols put in place for us as we enter the hospital now, both for patients and for staff. We actually have to go to a mobile app and complete a form asking us about our symptoms and attesting to the fact that we don't have any of these symptoms. And then when we come into the hospital, we have to show our ID. We are asked to sanitize our hands, and we are given a mask, not an N95 mask, but just a standard mask for patient interaction. Last week, all our patients were wearing masks. They were allowed to have one person, adult, with them, escort them if needed. And this week, the patients are not wearing masks. And we are still wearing masks. So right now in Massachusetts, we have about 2,500 cases, and there are about 25 deaths so far. The United States, as you probably have been reading, it's almost up to 100,000 people infected at this time. So we are expecting more cases to be coming in the next week. And we've been asked to, as a specialty hospital, we've been asked to clear our operating rooms so they can be used as ventilators if needed. There are definitely patients next door at the Massachusetts General Hospital that are in the intensive care unit, that are on ECMO, and again, our ability to pass through the hospital has become very complicated now. As well as businesses are shutting down and such, and we are rationing the use of personal protection equipment like masks and face masks, many things.
How did you organize in your service? Did you split the team? Are someone in charge of seeing those patients?
Yes, so a few things. One, we are rotating our residents around. So we have a residency of 24 residents at our hospital. So part of them are outside the hospital so they don't get sick. And some of the residents are in the hospital, mostly manning the emergency room. Because the governor shut down a lot of the non-essential clinics. The private clinics, many of them are closed. And so the patients are coming to our hospital for urgent care. So we have the residents on a rotating schedule. Sometimes they would spend time with us normally, but during the pandemic, they are actually been reassigned to this new schedule. Likewise, we're doing the same thing with our cornea fellows that are on the service with us. Some of them have been allocated to stay outside the hospital. They are taking phone calls from patients and answering questions. We have one fellow who's in the hospital to help us with urgent cases, and the fellows have been removed from our clinic, so we're seeing patients just by ourselves, which is fine. because we are not seeing that many patients. And then we ourselves, as the attendings, we've been designated to cover certain days of the week for the emergency room. So the emergency room will send the patient directly to our clinic for evaluation. And we are doing this on a rotating basis, day by day, for the next few weeks.
And are you taking any special measure inside the operating room?
Yeah, so it's interesting. At the very beginning, of course, you know, you've seen many YouTube videos now about how to make the shield for the slit lamp.
Yeah, right.
And we ran into that problem where we didn't have enough of these masks, these shields, to protect us during the exam. And that has been rectified in the past week. The other issue is we are now doing phone calls and virtual visits with patients, which is just starting. The governor has actually allowed us to see patients this way and still be able to bill the insurance company for it. So this is another big change for us as well. We do feel we're also an ears, nose, and throat hospital. So both ENT and ophthalmology are felt to be relatively at risk medical specialties because of our proximity to patients. Mm-hmm. And even though some of the studies haven't shown there's a lot of virus in the tears, our proximity to them in terms of respiration and nasal secretions is very real. And so because of that, you know, we're asked to wear face masks and goggles if we're doing any kind of procedure that involves aerosolization.
What is your personal impression? Do you think you are protected against this virus when you go to your hospital?
No, so it's very interesting. Of course, you know, ophthalmology, at least here in the US, depends on a lot of support staff. So we have a lot of technicians that work with us in the evaluation of patients and in testing. And our technicians are very scared. They're actually, they're worried they may be infecting their family. Likewise, we are also concerned about this. You know, I think we are an at-risk portion of the population, and several of our residents and our faculty have already tested positive. Uh-huh. Yeah, so we have about 5 people in the hospital that have already tested positive. Fortunately, no one has ended up in the intensive care unit, but 2 of them were fairly sick and are recovering. So I do think about this a lot, and I try to take all the precautions that are recommended. I think the hospital is being fairly responsible in helping us meet our safety requirements. And fortunately, we have had all the masks and gloves and goggles that we need, but another hospital across the city does not. So there are some hospitals here in Boston that are in short supply of the necessary equipment to protect them.
Okay. And in terms of corneal transplants, are you going to test if the donors are COVID-19 positive or not?
Yes, you know, this is a great question. I've not read anything, or I have one corneal transplant scheduled for next Tuesday, and they did not send out any. The eye bank is the biggest eye bank we have in the US, but they didn't send out anything specific about testing the donors for the virus. I think that's a very good question, and I may call them after this phone call to see.
About your fellowships, are you starting to think if you're going to make the rotation last longer?
No, I don't. So the main concern is probably surgical cases, because I think that depends on how, I mean, fortunately, it's about 3/4 of the way through the fellowship. So most of the fellows have gotten very good experience so far. But definitely our surgical volume is going to be much less, at least for 1 month, maybe 2 months. I don't think we feel we will have to extend the fellowship. But if this goes on for many months, it may impact the incoming fellows, I think, more than the current fellows. Usually we start in July with new fellows. But obviously I think the fellows will be very sad if their surgical volume drops significantly, just because it will have an impact on their overall experience.
And what about the university? Did you start classes online?
Yes, so of course, as you know, we have about 60 universities in the Boston area, and all of them have gone to online learning. All the schools are on online learning, and that this mandate to shut everything down kind of coincided with our spring break here. So most people were away or going away, but most of the universities told them not to come back, that they were going to continue to have their classes online going forward. So that is the current situation. I think many of the universities have stated that they are going to do the rest of the courses online. And so there are no plans to reopen the schools or the universities at this time, to my knowledge. Maybe some of the secondary schools might reopen, possibly, if this doesn't go on too much longer. But I think the universities, almost all of them, have agreed to, because most of the universities finish in May. So maybe we're talking 6 weeks more of classes.
Would you give us a final message to your colleagues here in Argentina? Something?
Well, so I think the message I would want to send is that this is a very serious situation. And I think we all have to be very vigilant and take all the precautions because, unfortunately, I think the virus spreads very quickly, although the mortality is relatively low. It will impact the way you work, how you work, and I think that we don't want to overwhelm our healthcare system. And if many of us get sick, we will not be able to help the people that need help. And we want to stay healthy ourselves so we don't end up in the hospital. So, hopefully our institutions and our professional societies will help us make the decisions, the important decisions we need to make going forward. And I hope Argentina is not too severely impacted and has seen what's going on in the rest of the world and is more prepared. I think hopefully the people of Argentina can follow directions better than Americans. Americans are not good at following directions. And I think that's why places like New York City have had an explosion of cases. But yeah, take it seriously, and we follow the rules.